Well, it's not every week in Grace's Girls Club we get to interview one of my dear, dear friends. But when you have a friend that's this accomplished, well, then it's a very special week. I want you to meet my dear friend, Ryne. Ryne, welcome to Grace's Girls Club. Go ahead and introduce yourself and tell us your title and the company you work for.
Good morning, Grace. It's such an honor to be here with you and just talk about what I get to do every single day. My name is Ryne Craig. I'm a physician assistant or PA here at the Orthopedic Center in Huntsville, and I work with a foot and ankle specific orthopedic surgeon.
There you go. So walk me through your day to day. I mean, I know when I was an athlete, I had to go see some orthopedic surgeons from time to time. But other than that, I wasn't really involved in your field. Walk me through your day to day and what it's like.
Yeah, I mean, it really is different day to day. We are in the office 2.5 days a week. So that looks like just seeing patients every single day. It looks like we have patients coming in with chronic problems, so arthritis, flat foot pain, anything like that. But then we also have some acute traumas that come in. So you fall, you accidentally twist your ankle, you have a sprain, you have a fracture. We're happy to see that and take care of that as well. And that's 2.5 days a week. And then for the other 2.5 days, we're actually here at the hospital or at the surgery center doing surgery. So fixing those acute traumas, those chronic problems, just to get people back on their feet again.
That's awesome. I know you're helping so many people. So when you're in surgery, on average, how long does the surgery take you? I know I'm sure there's a range, but give me a little bit of a
Sure.
range of how long we're talking about here.
It just depends. I mean, any sort of acute fracture, depending on how big it is, may take an hour or so. We do a lot of ankle replacements, and those can take anywhere from an hour to an hour and a half, depending on what all needs to be done in the surgery. A lot of times, you're not only fixing the problem, but you're correcting deformity as well to make sure that that replacement has longevity. But sometimes we're fixing big deformities that can take, 3+ hours. So it just depends.
That's a lot of focus. You know, your work is very specific, has to be correct. Every little minute detail matters. Focusing like that for one or multiple hours, that's a lot.
It is. It's a lot, but we enjoy it. We have a good time.
That's awesome. So of the letters in STEM, right? Science, technology, engineering, and math, which would you say you use most on a daily basis?
The science, just with biology and anatomy and physiology and those kind of things. Anatomy is a study of bones and everything that goes on in our body, and then physiology is more the cell level of everything that's going on. And so those are the main things that we use, I would say. Definitely a little bit of technology in there with implants that we use and things for surgery, but a lot more science than anything else.
Absolutely. So if I was watching this and I thought, this is great, I think I want to be an orthopedic PA one day, and I was a young girl, walk me through your educational path to get to where you are today, and then what you might advise another person to do to follow in your footsteps.
Sure. So it is 4 years of an undergraduate degree. I personally went to Auburn, so War Eagle. 4 years of an undergraduate degree, and then that can honestly be in anything that you want it to be in order to be a physician assistant. And then it is 2.5 years of a master's degree. So I do have a master's in physician assistant studies as well. And then there are some programs where you can go and do a specific fellowship for a year if you feel like you need that. I personally didn't. We got a lot of good training at UAB where I went. And so it is 2.5 years of a master's, and then it is working.
So I know that getting into PA school is one of the more difficult schools that you have to get into. What are some of the requirements? What are some of the things that they look for upon considering your acceptance?
Sure. It's not always, people always talk about GPA, and that's very important. It is ultimately, you being able to prove that you can do the book work associated with it, right? But it's also community service. It is what have you done outside of school to really set yourself apart. And so a lot of that was serving the community in church. It was actually, I had a job for about 9 to 10 months as a medical assistant in an orthopedic practice. So just learning how the practice worked, learning how to treat patients, learning how to interact with patients. And that can set you apart too, just having that background of patient care essentially.
Yeah, I really like that. Not often do you find things that especially in very higher level education that really focuses on your community outreach, but it's pretty cool
Mhm.
that PA school does.
Yeah, I think it just shows that you care about people in general. Being in this field, we all got in this field to take care of people essentially. And so to see someone who is already doing that, not in practice, just kind of shows that extra level of they do care about their community. They care about people in their community and taking care of them in the long run.
When looking at all these different things, why did you choose to be a PA? And then why did you choose to be an orthopedic PA?
Oh, that's great. To be honest, I really didn't know anything about a PA. I do know when I was in high school, I shadowed my local orthopedic surgeon, and he did have a PA, but I was really more just kind of following him around and asking him questions, and it was great. And then I knew when I went to school that I wanted to do orthopedics, like even undergrad, I wanted to be an orthopedic surgeon. That's what I was going to do. And I remember talking to my advisor who was definitely empowering me in that and thought that was great. But then she was like, well, have you heard about a PA? And I was like, not really. I've been introduced to one or two, but I don't really know what they do. And she said, well, I would really encourage you to just look into that as well. I think that may be a great path for you. If you're interested. And so I got into that a little bit, started researching that, started talking to people. And I just felt with the schooling, being a physician, you do have 4 years of medical school, then you've got residency, then you've got fellowship, and it's just a lot of schooling. And so I just felt like that maybe wasn't the best for me personally. And so I thought being a PA would kind of be the best of both worlds. I get to see patients, I get to diagnose them, I get to treat them. I don't have to go through all that schooling, but I am partnered with someone who did all of that and can teach me and be my supervisor and kind of work with me in that. And so it allows me to do everything that I wanted to do. It allows me to still be an orthopedic, still take care of people, but just in a different way.
Yeah. So is that the best part of your job then, working with that supervisor, or is it something else that you like the most?
Oh my goodness. I just love, I'll be very honest. I love surgery. It's such a great place to be. It's not every day people get to go into the operating room and see what we get to see and do what we get to do. But it's even cooler to be able to have someone come into your office with a problem that limits them on a daily basis. I can't tell you how many patients come in and they have a specific problem that limits them from going on vacation, that limits them from being able to hike and do the things that they want to do. And when they come to us and we can identify that problem, take them to the operating room, physically see that problem, and then correct it, and then to see them afterwards, and they are just so grateful, so thankful. I've been able to walk again. I've been able to hike and do the things I want to do. I think that's the best part.
Oh, I could easily see that. And especially, feet, walking, standing, running, that is so
Yes.
crucial to every single
Yes.
thing we do as human beings.
Mhm.
That's so awesome. So if that's the best part of your job, what are maybe some of the biggest challenges that you have to face every day?
Yeah, I think one of the biggest challenges I face is trying to take medical information and make it in a way or communicate it in a way that people understand, right? So I can't tell you how many people have come to our office and they have been to other providers and they just haven't gotten the information they're looking for. They feel like they're not being cared for, they're not being listened to. I think that's a huge thing that we face. And so some people just need you to sit down and talk to them in a way that they can understand, communicate with them in a way that they understand what's going on with them, and you can tell them things that they can do to fix it. And so that's a challenge, is to be able to really take the time, of course, in a busy practice, and take information that is really complex, but present it in a way that's understandable, that people can relate to, and that they can actually, take that and help themselves get better.
Absolutely. And that's such a great point that you bring up. I have limited, but still have some experience with surgeons. And at least in my experience, most of the time I spend a great deal of time talking with my primary care doctor who recommended me to a surgeon, spend a very small amount of time talking to the surgeon whose only solution is to go to surgery. And then you don't see them that much until you're actually, getting ready for that surgery. But what you're explaining, there's multiple options, and I spend time talking to you and we talk about your diagnosis and what that means. That is so important. And I imagine to people who are struggling, that can be very difficult for you, but is very life-changing for them.
Oh yeah, absolutely. And I think that is when we're in the office setting, I think that is my most important job. We as a team are very busy. There's 3 foot and ankle providers in our practice, and there's very little here in Huntsville. So just in general, we're very busy. But I look at my job is to go and see the patient, make sure that they feel heard, make sure that they understand what's going on with them, make sure they understand all the options. Like you mentioned, it's not always surgery, and not everyone's a good candidate for surgery. So making sure they're aware of non-surgical conservative things that can be done. And then if those things don't work, surgery can be more of a last step kind of thing. But that's my job, is to go in there and present all that information so that when he comes in, he can, have all the information available to him, so it makes him a little bit more efficient.
Look at that. See, she's a great provider. I know you can already tell that. Now imagine her as a friend. Even better. We got a real winner here, folks. All right, Ryne, before I let you go, I do want to ask you one more question, though. If you had a message to young girls or anybody, any young students in general, that were interested in joining the STEM workforce, what would your message to them be?
I think that it would just be that there's a space for you here. I mean, I think, we all grow up seeing the male doctor and the male scientist and all of those things. And that is wonderful. Men and women are created so differently, but so great in their own right. And the field needs men and women to really round it out. Our personalities are different, our brains work different. And so both are necessary to make this field as best as it can be. And so I would just encourage you, don't be intimidated by it. Don't run from it. But if it's something that you're super interested in and science and math is your thing, then just lean into it. There's definitely a space for you here.
That's awesome. Awesome, awesome advice and words to the wise. I couldn't agree more. Well, we are going to let you go, but thank you so much for your time and expertise, and officially welcome to Grace's Girls Club.
Oh, thank you. It's nice to be here.
It's great to have you, Ryne. Have a great day.
You too.